All right, so thank you, Dr. Lang, for being with us today and accepting or agreeing to do these few questions for the audience here in Argentina. I'd like to ask you about biomarkers for the diagnosis of Parkinson's disease and prognosis, if possible. And my first question is, which is the most promising biomarker for early diagnosis of Parkinson's disease?
Well, thanks, Blas. The field of biomarkers is very active, and we've been searching for markers that allow us to make a diagnosis for a very long time. This has really been revolutionized recently by the development of what are called seeding amplification assays, or SAAs. And these seeding amplification assays use the concept of the presence of an abnormally formed protein. These are normal proteins, but they become abnormally changed. And the structure or the folding of the protein allows us to measure the presence of this abnormal protein in various bodily fluids and tissues. And so we can now take the spinal fluid, for example, and define the presence of this very important protein to Parkinson's called alpha-synuclein. It's believed that this protein is abnormally or changed in all patients with Parkinson's disease. The misfolding of this protein is present in the brain of everyone that is diagnosed at autopsy with Parkinson's. But we don't need an autopsy anymore. We can actually take fluids, cerebrospinal fluid, in a living individual and show that this marker is present. And this is now believed to be 90% or more sensitive, meaning that anybody with Parkinson's, it's likely that 90% or more likelihood that they've got it. And it's also very specific to Parkinson's because it isn't seen in other diseases. We can also find the same protein present in other tissues like skin. And so I think we are now in a position where we have a very, very reliable biomarker for Parkinson's in an easily obtainable tissue like skin. Not everybody needs a spinal tap or a lumbar puncture to be able to make this diagnosis. And maybe in the future, and there are a lot of groups working on this, we'll be able to use the same techniques in the blood. And so I think we're very, very close in the next year or so to seeing a widespread application of biomarker diagnosis of Parkinson's.
Amazing. Thank you for that answer. And what do you think are the most important efforts currently to try to predict the prognosis of Parkinson's disease in terms of biomarkers?
So this biomarker I just mentioned, the seeding amplification assay, we measure this with a positive or negative result. So either you've got it or you don't. It doesn't tell us anything about the severity of the underlying disease or the stage of the underlying disease. So you're asking about prognosis biomarkers. Now, we hope eventually that technique might be changed and we might be able to do a level of severity, but right now it's just yes or no. There are other markers that might tell us about the severity of the underlying disease. So for example, there is a marker that looks at the severity of the degeneration that's much more positive in more rapidly progressive degenerations like multiple system atrophy, which is another degenerative disease that can be mimicking Parkinson's and mistaken for Parkinson's. So that technique is called neurofilament light, and we can measure that in the blood. So it may be that we can use something like that, not necessarily that one, but something like that, or a combination of other markers that tell us how severe the degeneration is, or how rapidly progressive the degeneration is. But right now, we don't have biological markers that do that. We really have to end up relying on clinical markers. We look at the severity of the movement problem. We look at the speed of progression of the movement problem. We look at additional features like whether there are changes in blood pressure or bowels or bladder function. or are there cognitive or psychiatric problems? And depending on the severity and the mixture of these features and the age of onset and others, we try to subdivide patients into different categories. And that's been done for a long time. There still needs to be a lot more work on that. So a combination maybe of upcoming biological markers combined with the clinical features may be helpful to give prognosis.
I understand, very clear. And the last question I like to ask you is, how do you see doctors in 10 years from now diagnosing Parkinson's disease?
Very likely that we will have a diagnostic biomarker like the one that I've told you about already. So a patient comes in and you think they may have Parkinson's, they will go to the laboratory the way they would if they had kidney disease or liver disease or something like that. We will have a marker that will allow us to make the diagnosis. And that marker will not rely on the patient having clinical features that we characterize now as indicating the patient has Parkinson's disease. They may have only minimal symptoms. They may only have a sleep disorder. They may have some difficulties with the sense of smell and bladder dysfunction or whatever. We recognize that right now we can only make the diagnosis of Parkinson's when the patient presents with the typical tremor, slowness, stiffness in muscles that the neurologist assesses in the clinic. But we recognize that the disease is present in the brain for a decade or more, well beyond or earlier than that. And so I think what will happen is we'll be making the diagnosis far earlier. We'll be making it very reliably. We may be able to separate out different subtypes of the disease, and we'll probably be applying treatments to change the progression of the disease even before the patient presents with the clinical features that we now need to make a diagnosis. So I think in the next decade, things are going to change remarkably.
Thank you very much, Dr. Lang.